G'day all, welcome to Case of the Day. Patient asks, while face down on the table, yesterday, is there a connection between eyesight and the atlas, the neck? And I responded, well, it's various answers to that question that could be approached. Number one, I have a lovely optometric spouse who often sends people to chiropractors who specialize in the atlas and the neck. And the reason is that she checks their eyesight and they're normal, but they still have some sort of problem with the eyes in terms of their ability to accommodate and visualize what they're looking at. So there's an answer of simply, when you have a head-on straight, you have eyes that are level with the horizon, and as we developed from being predators, or sometimes we were prey, we had to run from these threats and get away and survive. And the head must be on straight. If you look at a sprinter who's running, his head is fairly straight. I've got a beautiful video of a kookaburra whose head's on straight and body's moving. If you look at a chicken, if you take a chicken, my most adorable creature that I love dearly is a chicken, nothing personal, but they can be held and they can be maneuvered and their head does not move. It stays straight. That's called the righting reflex, not writing, the R-I-G-H-T, ing reflex. There's also the explanation that there could be an association between cervical spine function, the atlas, the neck, the whole gamut of muscles and ligaments and tendons. You see, the brain to the body connection is nothing more than a conduit. Now, if you're an electrician, you know what a conduit is. It's a tube that contains an electrical wire. Now, God put electrical wires through a conduit in your neck from the brain that also contain what? Fluid, blood, CSF, lymph. What is CSF? CSF is replenished in the body 3 times a day. Blood cells are renewed 120 days at a time. But CSF is so amazing. And Jack Kruse would say it's some sort of electromagnetic thing going on there. So you've got all this flowing through, and short circuits can happen. And short circuits can happen between the ears, tinnitus. But tinnitus can be a million other things. You've got eyesight problems. The eye is not quite, the head's not quite on straight, and the eyes are trying to accommodate, and the muscles are overworked, and all sorts of stuff going on like that. So you've got blood flow, you've got CSF flow. You've got Scott Rosa in New York that has done MRIs, dynamic MRIs, showing blood flow improvements from body to brain, but more significantly, CSF flow, that replenishing fluid that is vital to the nervous system. So great questions. I love answering questions that patients ask me. There is no question too silly, because you can always turn it around into a positive sort of slant. And it was asked in the first place, so there must be something that can be learned. So can vision be affected by treating the neck? Of course it can, because there's a structural component, there's a neurological component, there's a dynamic flow component, and there's a vascular component. Have a good one.